Hi, everyone. Thank you for joining us today to learn about the 14th National Survey of Older Americans Act participants. Due to technical difficulties encountered on April 16th when we originally held this webinar, we have decided to retape it so that a clear version can be accessed if and when you need it. Lance Robertson, the ACL Administrator and Assistant Secretary for Aging, was with us on April 16th to welcome you and provide opening remarks. Today, Susan Jenkins, Director of ACL's Office of Performance and Evaluation, has graciously agreed to read his remarks. I'm Kristen Robinson with the ACL Office of Performance and Evaluation. And from WestStat, we have Robin Ritter and Beth Rabitovich. Now I'll hand it over to Susan to read Lance's opening remarks.
Thank you very much, Kristen. As most of you know, the National Survey is an annual survey conducted by the Administration for Community Living that asks Older American Act service recipients if they are satisfied with our programs. I'm happy, and Lance is very happy, to say that our clients consistently tell us that not only are they satisfied with our programs, but that the Older American Act programs are also key to helping them remain safely in their homes and communities. The National Survey is important for two reasons. First, ACL is required by law to collect timely information to meet the accountability requirements of Congress and the administration for annual performance measures. Second, the results of the survey give our program staff and network a better understanding of what is working well and what could be improved. The Administrator, Lance Robertson, was personally involved with the survey and related to me that as the Director of Aging Services in Oklahoma, his office generated the AAA client list for the AAAs that were selected to be in the sample. Becoming the Administrator for the Administration for Community Living, he understands how busy we all are and that this is additional work on top of the work that you're already doing. However, now that he is the ACL Administrator, he sees how the data are useful to justify the importance of our programs in critical budget reports, such as the Congressional Budget Justifications, and how these data help decision makers better understand how important our programs are for older Americans. This administration is about return on investment. As with the 36 programs we are responsible for administering at ACL, we must fully commit to all activities that confirm the efficiency and effectiveness of the $1 billion we invest in this program. Responsible stewardship, best demonstrated by data, is a collective responsibility for us all. Lance and I encourage you all to do everything you can to support this survey. For those of you who have supported this survey in the past, thank you very much. For all of you who have been selected to participate in this round, we both thank you in advance for your support. So speaking now as Susan Jenkins, the Office Director for the Office of Performance and Evaluation, I want to reiterate and support everything that Lance communicated, but also I want to thank you personally for those of you who have participated in past surveys and evaluations through our office, and thank you to those of you who are participating this year, as well as to thank those of you who will participate in the future. The Older American Act funding levels and Older American Act reauthorization depend on our ability to provide data about the value of the program to older Americans, their families, and caregivers. We truly could not do this without you.
Thank you, Susan. Today's agenda includes a brief background on the NSOAP, which is the acronym for this survey, some data examples, process and procedures of the survey, some highlights on the redesign of the survey instrument, and finally, we'll post the questions we received during the live webinar on April 16th. On the next 3 slides, I'm going to provide you with a brief background of the NSOAP. The National Survey of Older American Act Participants, or NSOAP, is an annual collection of surveys conducted by the Administration on Aging. It's administered as a telephone survey to a random sample of Older American Act service recipients. The primary purpose is to provide the aging network with outcome information that demonstrates the effect of services and illustrates client-reported quality of service. Service recipient demographics, health, and well-being indicators are also collected. The NSOAP has 6 service-specific surveys: home-delivered meals, congregate meals, transportation, homemaker, case management, and caregiver. The caregivers surveyed come from the National Family Caregiver Support Program. The NSOAP measures the extent to which the goals of the Older Americans Act have been met, for example, targeting, access, and coordination. The results of the NSOAP support ACL's yearly budget request to Congress. The budget request is accompanied by a 257-page justification. Included in the section on health and independence of older adults are results that show the extent to which the services help clients remain independent in the community. The results of the survey also support program design by allowing the Administration on Aging to better understand program and service trends, and results have been used by ACL-funded resource centers to design and target technical assistance efforts to the Aging Services Network. For example, this slide uses NSOAP data to show how 55% of older adults rely on Older American Act transportation services for the majority of their trips. And these trips include getting to the doctor or pharmacy or attending a meal site. In another example, the survey instrument has an item that asks participants if the caregiver program helps them to continue to care for their care recipient. In 2017, 59% of the survey respondents said yes, and 41% said no. In this slide, we show that among the 41% who said no, the care recipient would not be able to continue to live in the same residence. 60% of them said the care recipient would be in a nursing home without the service. This means that among all care recipients, 22% would potentially live in a nursing home without the caregiver service. If you're interested in learning more about the survey or how the data are used, you can go to these websites. Their website for the Administration on Aging Program Evaluations and Other Reports, NSOAP Research Briefs, and AGID, which is the ACL Data Web Portal. Now I'm going to show you one example of how you can access NSOAP data. First, go to www.agid.acl.gov. Select Custom Tables. Scroll and select National Survey of Older American Act Participants Custom Tables, and you will see this page. While the 2018 data have not yet been posted, we expect that to happen in a few weeks. Here we will select 2017 by clicking in the box in front of 2017 so a check mark appears. We then go to the data elements and use the right pointing arrow to open Homemaker, and under that to open Satisfaction with all services client received. From here, we click in the box to add check marks to the items of interest. Then we click Next. Now we have some options. In this case, we will go to Stratifiers and select No Stratifier. Then we click Next again. And then we see results. We see that 93% of recipients say services help them live independently. 90% say services help them to feel more secure. And 91% say services help them to care for self. Here are those same items from 2017 in a bar chart I created when I saved the data to Excel. Now I'll hand it over to Robin.
This is Robin Ritter from Westat, and probably one of the first questions that you ask yourselves when you receive the Federal Express packet of information from Westat about the current year survey is you want to know, how is my AAA selected? This year, 350 AAAs and single PSA states were selected from an overall list of 629 AAAs across the 50 states in the District of Columbia. In past cycles of the survey, AAAs were selected by budget size using a tiered approach. AAAs with the largest budgets were always selected, and then we would randomly select additional AAAs representing mid-size and smaller budgets, and also balancing them by geographic region. This year, our statisticians retooled the sampling procedures using a method called probability proportional to size, or PPS. So the probability is actually proportional to the total number of clients in a AAA. This year, many more AAAs that have a larger number of clients were selected than usual, although we still did select some smaller ones as well. And so how does this work? What we ask you to do is to use your client tracking software system to create client lists by service, creating a client list for each of the 6 services that are being surveyed this year. case management, congregate meals, home-delivered meals, homemaker, transportation, and caregiver. In many states, the State Unit on Aging actually has the capability of generating these client lists for their AAAs, and in a few minutes I will show you a slide showing which states that we're aware of are doing this for their AAAs. Once we receive the client service lists from the SUA and or the AAAs, we randomly sample the clients from that list. We ask you to provide the list to us in Excel, and in an Excel spreadsheet we number all the rows representing the clients, and we have a computer program that just selects random row numbers until we're able to get a core group of people to be sampled for the interview. So clients are randomly selected for the national survey. If a AAA has all 6 services, 105 clients will be randomly selected. If a AAA does not offer all 6 services, we'll select a smaller group of clients for the interview, usually about 14 clients for congregate meals, maybe 16 clients for home-delivered meals, etc. But overall, our statisticians have estimated that with full AAA participation and getting client lists from all the AAAs, this will yield over 27,000 Older Americans Act clients that we will send letters to informing them about the survey. We know that we will not be able to complete telephone interviews with all 27,000 of them due to clients that have moved, are deceased, are unable to participate due to health or language issues, or for those who choose to opt out. Based on outreach to over 27,000 clients, our target is to complete interviews with just over 6,000 clients. So this is what you can expect. Whenever possible, to minimize the burden on the AAAs, we reach out to the states to see if they can assist with generating the client lists for their AAAs. If your State Unit on Aging is unable to help with generating the client lists, we will work directly with your AAA and try to connect you with resources from the commonly available client tracking software systems. We have asked that initial client lists be provided by May 10th. If you cannot make the May 10th deadline, we have some flexibility because we will continue conducting telephone interviews with selected clients into September. Currently, we have received client lists from over 70 AAAs, so we are in good shape initially to begin telephone interviews on June 4th with the clients, but we certainly need more AAAs to submit their lists so we can continue to interview and reach our 6,000 target. In 2018, we had 24 states that generated client lists for their AAAs, and kudos to Colorado for being the first state this year to submit client lists for all 5 AAAs that were selected this year. In addition, we've received client lists, AAA client lists from several other SUAs this year, which are highlighted in green and have an asterisk on this list. You may notice for most of these states, just the name of the state is listed. In Missouri, IDS, or Innovative Data Systems, which is the company that manages or owns the client tracking software system used in Missouri, they have already generated client lists for all of the Missouri AAAs as well as a number of AAAs in Illinois. In Iowa, we discovered that the Department of Aging no longer can generate lists at the state level, but Dick Harmon, who used to be with the Department of Aging and who is now with Northeast Iowa, has now taken over that responsibility, and he has been able to generate client lists for all of the Iowa AAAs. If you don't see your state listed up here, you can contact your state directly and ask if they can do this for you. As a result of the webinar that we did in 2018, a AAA in Indiana posed this question to their SUA, and as a result of that conversation, Indiana now generates client lists for all of its AAAs. So over the years, we've heard various concerns from AAAs about why they don't want to participate in the national survey. We hear that there's a shortage of staff, which we realize because, after all, you're in the business of service delivery. Other AAAs complain that they're picked every year. They have privacy concerns. They're worried about their clients thinking that when our interviewers call them that this is actually telemarketing fraud, and they're concerned that there's nothing in it for them because they don't get the survey results. These are the solutions that we have to some of the common concerns that we hear from the AAAs. To minimize the time available, we have worked with all of the common software tracking vendors to create step-by-step instructions for AAAs to use to generate their client lists. We understand that AAAs who have SAMS instructions can pull up a pre-configured SAMS service delivery consumer listing report, and AAAs have assured me it takes them less than 20 minutes to generate all 6 service reports. To also save AAA's time, we want you to know that WESTAT sends out letters to the clients, to the selected clients, letting them know about the survey, and we handle all calls from clients who want to opt out before they're contacted. In the past, we had asked AAAs to provide us with their AAA letterhead that we would use to actually generate the letters that went to the clients. This year, ACL has decided that we should use ACL letterhead, and all envelopes that are returned by the U.S. Postal Service will be returned to WESTAT, so we will handle that volume. It's another thing that the AAAs don't have to worry about. As far as concerns about telemarketing fraud and the clients being concerned about taking the call from WESTAT, we can let the clients know what caller ID information to look for when WESTAT is calling to do the survey. We also have an option for the clients to take the survey at a time that's convenient for them. We can give them a specific toll-free number where they can call in to take the survey at their convenience. What we also suggest is that AAAs can inform providers about the survey and which clients of theirs were selected. So when a client gets the letter from ACL saying they've been selected for the survey, if they ask the provider some questions, the providers will already know about this and assure them that this is a legitimate survey. We also want you to know that our interviewers spend extra time in training, being prepared to work with the needs of older adults. We often find that when the interviewers get the client on the phone, the client actually is very open to talking, so much so that we have to train our interviewers to be polite but firm as well as empathetic and be able to move on to the next question so that we don't take too much time in completing the survey. This is a list of some of the commonly available software tracking vendors that we work with and that we have step-by-step instructions. If you're in California, Care Access, which is also part of SourceWise, not only has instructions, but some years they have been willing to actually generate the lists for AAAs in California. Also, I discovered through the chat feature from our April 16th webinar that ServTracker, which is maybe not as commonly used as some of the other software companies, but it is used by the AAA in Salt Lake in Utah. That's Homemaker there, agreed to be a mentor for any ServTracker AAA customers. She will help walk you through how to generate your reports in ServTracker.
This is Kristen.
Go ahead.
This is Kristen again. The Administration for Community Living takes data security very seriously. ACL is not requesting that you provide individually identifiable health information, which would be protected under the HIPAA privacy rule. Individually identifiable health information is information that relates to the individual's past, present, or future physical or mental health or condition, provision of health care to the individual, or past, present, or future payment for the provision of health care to the individual. Once respondents for whom your organization has supplied contact information have been contacted, name, address, and telephone number will be deleted from the system, and zip code is the only information that will remain in the system. In addition, the contractual agreement between ACL and WESTAT includes specific clauses related to the protection of personal data. Now I'll turn it over to Beth.
Well, now I'm going to talk about two projects that we had to redesign the NSOAP survey instrument. For the past couple of years, WESTAT has supported ACL on redesigning the NSOAP. As you may have heard, ACL was considering turning the NSOAP into a 3-year longitudinal survey starting this year. However, recent ACL data collection efforts have encountered larger than expected dropout rates among the participants have demonstrated the need for further research into changing the survey design. It's very important that ACL have nationally representative estimates each year for the required Government Performance and Results Act reporting, also known as GPRA reporting. Therefore, ACL will maintain the NSOAP cross-sectional design for at least 2019 to have time to properly address methods for reducing dropout rates for future surveys. Now I'm going to talk about two contracts that WESTAT had with ACL to redesign the NSOAP. So in addition to designing different approaches to the survey, we also updated the survey instrument. So in the first phase of the redesign project, ACL convened an expert panel where they reviewed the existing survey instruments, recommended new modules mostly from nationally represented surveys. For instance, they recommended questions on falls from the National Health and Aging Trends Study, which is a study of the general population of older adults. Life changes, meaning the reasons for contacting AAAs in the first place, social integration, and the USDA food security questions. So in the phase 1 of the redesign efforts, we held this expert panel, went over recommended questions, and then redesigned, or as we say, updated the survey instrument for home-delivered meal clients, congregate meal clients, and caregiver clients, and did some cognitive testing in which we called clients and administered the survey, but we also asked them questions about the survey items, whether or not they were clear, how did they interpret them, to make sure that they were interpreted as we intended them to be. I want to make a special thank you to the AAAs that allowed us to use additional clients who hadn't been sampled for the NSOAP for the cognitive testing. We really appreciate these clients' participation. So in the Phase 2 part of the redesign project, we included the new modules in the case management, Homemaker, and transportation survey modules, and did cognitive testing with them. And again, thank you to the AAAs that let us recruit the additional clients. So now I'm going to talk a little bit about the results of the cognitive testing, whether or not the clients were able to interpret the questions the way that they had been intended to be interpreted. So all of the new questions, the questions on falls, life changes, USDA food security questions, and social integration questions show that during the cognitive testing, respondents had no problems interpreting the meaning of these questions. Now, some changes we did make in terms of the congregate and home-delivered meals questions, the questions about food intake, in other words, what proportion of the food at the meal site did you eat, we removed those questions. So they were not tested, and they're not in the updated 2019 survey instrument. So as I said before, we added the USDA food security questions, and just to give you an idea of what the questions are, the first question is, the food I bought just didn't last and I didn't have money to get more. And then the clients are asked, was that often, sometimes, or never true in the last 12 months? The next food security question was, I couldn't afford to eat balanced meals. And the third one, in the last 12 months, and we give them the date, 12 months ago, did you ever cut the size of your meals or skip meals because there wasn't enough money or food? We also added a question, or I should say ACL, the expert panel, decided to add a question on what was going on in your life that led you to seek services. Was it illness of a person close to you, death of a spouse, problems with mobility, could no longer take care of myself, could no longer take care of my home. So ACL thought it was important to know why clients sought services, which would help them with program planning. Now I'll turn it over to Robin.
During our first attempt to do this webinar on April 16th, we had a huge audience of probably over 160 people, and we had a lot of questions come in through online chat. I've gone through and taken some of the most commonly asked questions. We had a lot of repeat questions. So these are just some of the highlights of the questions we received. One question we received was, someone said, how do we provide you with the AAA client list since email is not secure? And we do not use email at all to transmit client lists. We've established a secure website, AOAsurvey.org, for SUAs and AAAs to upload their client lists to that website. Once we receive the client list, we do the sampling. When we've selected the 80 to 105 clients from your particular AAA who are randomly sampled to be in the survey, we upload that list of selected clients back to each AAA's individual portal on the website, and we send you an email notice on when it's available for you to retrieve that list from the website. In fact, we may be taking the website down just very briefly to add even additional layers of security. So we are very concerned and do the utmost to protect client security. This website is only seen by just a handful of people at WestStat that work on this survey, and even when the client information, when the results are delivered to ACL, all of the client information is totally stripped out. Someone else asked about the date range for submitting client service lists. We ask that you try to generate your reports based on the most recent 12-month period, which would be April 1st, 2018 to March 31st, 2019, or we're almost at May 1st through April 30th. If you're not able to use that time frame, you can go by a fiscal year or a calendar year, whatever system you use. And someone else asked a related question saying that they had just converted to a new software system and could only go back to January 1st to generate the client lists. And that's fine. If you only have 3 or 4 months worth of data, that's fine too. And the reason why we encourage the most recent list is to make sure that we have active clients who have not moved away or who may be deceased. Someone else asked about the use of provider on the client lists. So by provider, we actually mean the service provider if it's someone other than the AAA. During the actual telephone interview, we asked the client about services they've received from the specific AAA whose list we're using, but we also referenced the service provider for the client to be able to put that in context, because we know that some clients are actually even more familiar with the service provider than they are with the AAA. But an example of a service provider could be the specific senior center where someone goes to receive their congregate meals, the name of the home delivered meals or Meals on Wheels provider. But in the case of case management or for family caregiver clients who receive counseling under the Family Caregiver Support Program, in those instances, the service provider could actually be the name of a case manager or a counselor. We also had a number of questions about when will the client letters be mailed. For those AAAs who have already submitted their client list to us and we've selected a sample of their clients, we will send the letters to the clients the week of May 20th. That will allow about 10 days to 2 weeks before telephone interviews start, and it will give the clients time to contact us to opt out or to contact us with questions. We had a number of chat comments also about procedures for how the AAAs should handle client concerns. We don't have anything formal for you in writing, but we want you to be able to just reassure your clients that this is a legitimate survey, explain to them maybe some of the reasons behind why this survey is done, the importance of justifying continued funding for Older Americans Act programs. And a good technique that a number of other AAAs use is to let their service providers know about the survey and even which specific clients were selected for the survey in case the clients have questions for the service providers. We had a number of questions come in during the chat about instructions for specific software vendors, and if you refer back to the earlier slide, again, we have instructions for most all client tracking software systems that we are aware of. You can always contact us for additional help in working with whatever software tracking system that you're using. And before there was client tracking system, we had AAAs that would actually Federal Express to us hard copy lists that we even use to select a random sample of clients. So we try to be as flexible as possible, and we'll work with you to do whatever it takes to come up with the easiest way for you to provide client lists. We had numerous questions during the online chat about whether specific states would be involved with generating the list of randomly selected consumers. And once again, we refer you to an earlier slide where we listed the 24 states that provided this assistance last year, and you can also inquire with your individual state and see if they have that capability.
Thank you, Robin. Please participate in the 2019 survey. ACL relies on national survey data each year for its annual budget requests and performance measurements. ACL and AOA specifically utilize the data to improve programs.
And WestStat will work with you to accommodate your schedule and any issues you have with the client lists.
Thank you. This brings us to the end of our webinar. If you would like more information, you can contact me, Kristen Robinson, at kristenrobinson@acl.hhs.gov or WestStat at aoasurvey@weststat.com. Thank you again. Have a great day.